Okay, good evening, everyone. So, as you all know, we're gathered here for this webinar on machine learning that has been so gracefully supported by our uh, director and everyone from the Relay team. So, I would like to start off by introducing our speaker today. Her name, Miss Anuradha Srinivasa Raghavan. She is a machine learning specialist from the University of Mumbai. She has vast experience in working in the field of machine learning, soft computing, data mining, database, and artificial intelligence. She has helped various students pursue their projects on machine learning and artificial intelligence alike. And today we are lucky to have her as our speaker. She completed her postgraduate in computer engineering in 2008 and has been an associate professor in in the Mumbai University for the last 15 years. I would like our director, sir, Professor Rakesh Saxena, to address her and talk to her for exchange a few words with her. Sir, if you please.
Welcome all. Welcome, speaker. Thank you very much for sharing your experience for our students, faculty, and everybody. So we can start now immediately. Thank you very much, and thank you whole team for arranging these webinar and seminars for our institutes. Thank you. We can call madam also to institute in any time to our department for further interaction. Okay, thank you.
Yeah, thank you one and all, Wiley and the college for giving me this opportunity to address y'all. And probably this is the second time I'm having an encounter with most of y'all, and I'm really privileged to be a part of this webinar so that at least we'll all grow together in finding out the research opportunities open for finding some possible cure or eradication of this pandemic. So let me share the screen. So is my screen visible to all? Is my screen visible?
No, not yet.
Ma'am, not quite yet.
1 minute. Yeah, now is it visible?
Yes, ma'am.
Okay. So to start with, now the topic which I've been called as a speaker for this webinar is how will ML aid in the prediction of COVID? Or I can put it in other words, can ML aid? Can it do anything for the present scenario? We are all held up. We are all locked down for say more than 50 to 60 days. Is ML going to help us? So this is something I don't know whether it is a notion. We have a new technology in place. We have AI and ML. So now we try to find solution for all the possible problems in the world using this. So it is not wholesome. To start with, let me tell, it is not a wholesome package. ML alone is not going to solve, is going to provide a solution to the problem, but well, it can provide certain solutions wherein certain parts of it can be, certain functionalities of it can be speeded up by using the concept of ML, and research has been going on in those directions. So towards the webinar, I'll be touching up in some of the places where ML is actually used as of today. So let me start with the basics of where this is for all those who don't have some basic idea of ML. I just wanted to give 1-2 slides on what is it before we jump into further on how it is going to help us. So as you all know, ML is nothing but turning of data into information. With the advent of network speed, big data analytics, data science, we see that there is a overwhelming collection of data. So this data, when it gets processed, it becomes useful information. So this useful information can be used for modeling systems, can be used for finding out the hidden patterns which are present in the system, and it can also be used hand in hand with artificial intelligent expert systems, so that the place where human intervention can be reduced, most of the mundane tasks can be automated. The learning of those models require machine learning techniques. So it is actually an intersection of computer science, engineering, and statistics. So the examples which I have put is something, it's just futuristic. You would have heard about the Google self-driving car. It is something which is available in market in US, not in India. But the Google self-driving bicycle is one which is, the research is going on. If you see, the kids are able to drive to the park themselves and play in the park without the intervention of parents. Similarly, you can have robot which is used for farming vast agricultural land. So this is the future of it, wherein people try to use AI based projects for automating most of the tasks. So most of the machine learning comes under two categories: supervised learning algorithm and unsupervised learning algorithm. In supervised learning algorithm, we have a labeled output. So with respect to the label output, the model will be generated, and based on the model, based on the accuracy of the model, we can use the model for prediction. But in the case of unsupervised learning algorithm, it is a raw data which is yet to be modeled. So it depends on users' perception of viewing the data, tagging the data. The pattern which is present in the data will be exploited. So the most of the models for which you have lots of work which is going on in convolution neural network, deep neural network, belong to the category of supervised learning network, because it's more like a teacher teaching students. A teacher knows what is to be expected from the student, so she has an output. So when the student learns, the system, the teacher checks whether what the student has learned is as per what she desires the student to learn. So till such time the learning is accomplished, the system is being trained and the model is being built. So the same logic is being used in the case of your supervised learning algorithm. As a typical example of your supervised learning algorithm, you can see in this particular case, this is a classifier. You have certain fruits. The fruits have been labeled as, say, green colored fruit or red color fruit. And the data is split up into the input parameter and the output parameter, which gives the labeling for the data. And it goes to any machine learning algorithm. A machine learning algorithm which gives a categorical output is called as a classifier, and which gives a time series output is called as a regressor. So usually when you want to work as a classifier, we know the output is either a binary classifier or a multimodal classifier. So based on it, the system learns and the accuracy is being checked. So when an input sample is being given to the model just predicts the output on what type of category it is. So this is the most simplest of machine learning algorithm, wherein you know the output, the system is trained till such time it learns a particular output. But that is not the case in the case of your unsupervised learning algorithm. In the case of unsupervised learning algorithm, as shown in the diagram below, you have different data sets. The interpretation of the unknown data set is as per the user. So different metrics are being used. The algorithms are either distance-based algorithm, density-based algorithm, hierarchical algorithm. And based on those algorithms, the inputs are being clustered together. They are being combined together. That is, similarity in patterns are being coagulated together or consolidated together. So the output in this case, you get clusters. The clusters within the cluster, the inter-cluster similarity between the objects will be more, and the intra-cluster similarity between the objects will be very less. So there is a lot of discrepancy between the objects belonging to different clusters. But how the clusters are formed, what are the parameters, it whole and soul depends on the perception of the user. Now, for the learning algorithm which we are going to use for COVID data, till now, only the concept of supervised learning algorithm, as per my research, whatever I have studied to the couple of papers which I have received for the last couple of days, mostly supervised learning algorithm is being exploited for this particular purpose. Now, so far, so is for the basics of ML. So now how this is going to help us in predicting the spread of COVID. It can be anything. Now we'll see what are all the different angles in which ML can be used in this particular case. Now to start with, this COVID was declared as pandemic somewhere in mid February 2020 by WHO. It started in a small place in Wuhan of China, and it was first thought that it was because of the wet market between the genetic combination of a bat and the pandemonium. It had started, but the cases, it turned the one which was an epidemic to start with in December, January, it had become a pandemic, and it had started affecting world over. So the entire data pertaining to every minute data, or it gets updated twice in a day or thrice in a day, which are all the places which is affected, and the latest details pertaining to it, you will get it from the site www.worldometers.info. Now, the latest figures as per the coronavirus cases, this I have taken as of today. As of today morning, 10:30, that is estimated to have around 48,94,278 confirmed cases, with 3,20,188 deaths all over the world. This is an overall figure, and the figure pertaining to India, which you have a separate dashboard for India, which is covid19india.org. As per those figures, we have crossed our 1 lakh boundary. We have, as of now, 1 lakh 1,283 cases with 58,886 active cases, and with a very good recovery rate and a sufficiently low mortality rate of 3,157. So this is the statistics of a day. As you all know, any technology should help us in finding out a quick and a easy solution to the problem on hand. So let us see how ML is going to help us in finding out at least some solutions for this present problem in hand. So as far ML is concerned, machine learning to aid in the curtailment of COVID-19. It helps in curtailment in 4 different areas. First, some algorithms are used in drug discovery. There are some algorithms which are helping the health workers, the doctors in quickly analyzing the CT scan reports and the X-ray reports of the pneumonia affected persons. So medical imaging and deep learning is being used in those places. And for forecasting the spread of diseases, we have certain ML algorithms which are used in those places. The estimating the spread of diseases can be used from the social media data which is being analyzed, and it helps in estimating the spread of the diseases. So as I've told you before, ML is not providing a wholesome solution but it is aiding important areas wherein the solution can be arrived at a exponentially lesser time, at a very much lesser time, so that many lives can be saved. So ML is used in predicting the structure of proteins and their interactions with the chemical components to facilitate new antiviral drugs and vaccines. This is the need of the hour. For any vaccine to be invented, it will take a lot of clinical trials. And it is not something which happens within a matter of months. It takes several years to find out the viral or vaccines for any new viral which has come into existence. But now that process has to be fastened because we have to reduce the number of lives which are being lost because of this COVID. So it is in that portion ML is being used. It is also used for forecasting the spread so that we can have an idea about the requirement for hospitals, requirement of ventilators, where it is required, all those things can be forecasted before. So in such places also ML is being used. And the persons who are more affected in this case are only health workers because they are the ones who have to be in constant touch with the patients. So deep learning algorithms can be used for for medical imaging, for reading the X-ray and finding out the severity of the cases wherein the human intervention can be lessened. So in such places also ML can be used. Finally, it can be used for social media data to get a better estimate of the spread of the disease. Now, let me go into each and every single case wherein we will see what work is being done so far in different areas. So to start with, ML is aiding in predicting the protein structure. This is one area wherein as a ML person, a complete intervention of a genetic engineer, a genetic person who is working with genetic engineering or with virologists or biochemists is very, very mandatory. Because if you see, you have deep learning based drug screening, and this particular approach, it takes the RNA sequences and it tries to analyze these RNA sequences into protein sequences and build a protein 3D model using homology modeling. So in this case, you have your DenseNet or DFCNN can be used to identify the protein interactions with higher accuracy. This is actually a funded project in China, and the manuscript of the project is also available online. Now, not only the existing RNA sequences, the existing antiviral drugs that can act on other diseases like other autoimmunal diseases like HIV is being found out, and based on the sequencing, the same type of medication is administered to a patient who's severely affected on account of COVID. So in this case, a deep learning drug target interaction module using molecule transformer drug target is being used. DeepMind, which is a technology which uses some of the available data sets from GIS-AD and AlphaFold library of biochemists, which has got some DNA sequencing, can be used to predict the protein structures of the COVID virus. So this is entirely based into the drug discovery, and these are some of the research areas which are open up for drug discovery, and work is going on in this particular area. Next comes a person is affected, a country is affected. How is ML going to aid in forecasting the infection rates and patient prognosis? So in this case,
we need to predict the criticality of the patient. How critical is the patient? So for this, a machine learning based prognostic model was used with the clinical data which was available in Wuhan. So the authors of this particular research paper, they used a XC boost algorithm, which is an ensemble based algorithm using gradient boosting model to predict if a patient infected with COVID-19 would survive the infection based on age and other risk factors. So this is very useful for forming recommendation about who should isolate themselves from the disease the most. Next, we had a data-based analysis and modeling for forecasting COVID-19 outbreak. It works on a logic which is called as susceptible, infected, recovered, and dead module. This is called as the SIRD module, SIRD, SIRD model. This is a multiplex network-based approach. The recovery time in epidemic spreading was also investigated in this particular work. And time series analysis was used using the Kalman filter to predict the spread of coronavirus spread. Based on the current number of cases, the time series analysis was very accurate in prediction of 1 day prediction of based on a particular day, particular region, on how quickly the spread will get propagated. But for longer period predictions, still work is going on in the using the concept of a Kalman filter. So next comes your ML, which is aiding your doctors for medical imaging by automating the process of studying the X-rays and the CT scan. As you all know, the ultimate or the most severe COVID cases, the patients are affected by pneumonia. So the X-ray or the CT scan of, and there are different ways of checking it. As of now, the throat swab is being checked, and it takes at least 2 days for the results to be out. And I know many cases in Bombay, wherein after the throat swab is being removed, the person dies, and the next day they get the result that the patient has died of COVID-19. So these are all a very tricky and really a very scary situation which is going on in the current scenario. So this particular approach, ML aiding diagnosing of medical image like X-ray and CT scan, we have deep learning based model for detecting COVID-19 pneumonia on high resolution CT scan, and a study is being going on in this case because it helps lessen the burden of the doctors, and also it provides more insight into the disease itself. Not only that, AI empowered image acquisition methods can also be significantly help automate the scanning procedure and also reshape the workflow with minimal contact to the patients, providing the best protection to the imaging technicians. AI can improve work efficiency by accurate delineation of infections in X-ray and CT images, facilitating subsequent quantification. The computer-aided platforms help radiologists make clinical decisions for disease diagnosis, tracking, and prognosis. So there are lots of research papers which is available using the concept of AI, wherein right from the time the patient enters the hospital, the patient is not interacting either directly with a lab technician or with a doctor. There is assistant learning screens through which the patient is being made to lie on the CT scan equipments. The scans are being automatically taken, and using the concept of image segmentation, the affected portion of the lungs is categorized from, that is a COVID positive patient with higher degree of who's affected to a higher degree is categorized from the patient who is not affected to that higher degree. So what happens in this case, the time taken for remedial actions becomes very quick. So these are some of the portions where AI techniques, deep learning can be used for segmenting and classification of CT images of COVID-19 patients. Next is, how is ML going to help in the spread of disease? So when coming to the spread of disease, a review of influenza detection and prediction cases through social networking sites was taken, and that was used for finding out the similar spread of disease in the case of COVID. So search engines and social networking sites can be used to track trends of different diseases 7 to 10 days faster than government agencies such as Center for Disease Control and Prevention. So that is why some data from social networking sites are being used in order to predict the spread of this particular disease. And also, you have influenza levels using real-time social media stream. That is Google Flu Trends, which proposed a method that uses online search queries data to estimate the influenza activity, and it helps in predicting the future influenza activities. It provides more accurate real-time assessment and combines real-time big social media data and the historical data sets for predictive models for accurate predictions. So the last one, characterizing the propagation of situational information in social media during COVID-19 epidemic. This is a very recent paper of April 2020. In this case, WIBO data and NLP techniques are used to classify the COVID-19 information into 7 types of situational information. The situational information can be obtained from information pertaining to caution, advice, notification, donations, emotional support, help, etc. From the WIBO data, the number of ports, the number of attributes were collected, and from this research, the authors concluded that the content type of the post should be given more importance at the early stage of epidemic to understand the need of public. So this is very useful for researchers or practitioners who aim to build effective social media based emergency response programs and crisis information systems. Next comes your advanced analytics for COVID data. So in your advanced analytics, the talks of different types of tracking the COVID data. Why COVID data has to, why the COVID-19 has got this hype? Why there is lockdown almost in all parts of the world? This is because the RO factor or the spread factor of this disease is 2.2, which is really very high. His counterparts of COVID, that is SARS and MERS, they were more fearful when compared to COVID. But the spread factor of those diseases was not as much when compared to that of COVID data. That is the fear behind the COVID data. So the tracing of the data is very important. So the contact tracing is imperative to ensure that anyone who's close contact with the infected patients are traced, isolated, monitored for symptoms. So this is another way of looking at things. You have a drug way of looking. We can find out solution to drugs. It can help the the medical professionals in quickly identifying the intensity of through which it is affected. Then through social media data, it can help in finding out the spread of disease. Now through this advanced analytics of COVID data, we can find out how this contact tracing can be reduced. So the first one is your spatial temporal analysis. So advancements of GIS tools allow the spread of COVID-19 to be modeled through various spatial and temporal scales. So mathematical and statistical techniques such as Bayesian inference methods facilitate the analysis of infectious disease incidents through time and space. Next is your path analysis. So a diagram which is used in this case is called as a Sankey diagram. It helps to visualize the flow of patients between various phases of patient's journey. The multi-dimensional visualization helps to understand the flow and category of relationship of patients to specific outcomes. Next, we have a graph data. So if you would have noticed the COVID-19india.org, initially when the spread of data was really less, we have your graphical analysis of the data. So this graph analysis of the data, it helps in telling the degree of interconnectedness between the cases and the infected clusters, and it can be visualized in the form of a network map. In this case, every node in the map is an infected patient, and every edge represents the transmission of the contagion through a known contact. So this was initially used. Now, today when I checked out the COVID-19 India this thing dashboard, I was not able to locate this graph because there was a capacity. There is actually a capacity for the graph. So initially when the numbers were in few thousands, a graphical analysis gives a given a very good identification of who had spread. So there is a famous example for it. One person in Spain was able to, they were able to find out had spread it to around more than 250 to 300 patients, and this analysis they were able to make because of the graph analysis from the graphical data. Next, you have enter telco analytics. So this enter through this by the personal electronic devices or PEDs, which is used by the patient, like which ranges from their smartphones, tablets, smartwatch, fit trackers, and other electronic accessories that people bring around with them, and using that they will be able to find out whether the infected position is in quarantine or whether the person is moving around. So this is used for giving an indication to the persons around that how many persons are infected or whether they are infected person is within the same range or not. So you would have all seen the this thing, the one which is being used by the government, which is your Arogya Sedu app. And this Arogya Sedu app, it does the same thing. If you see, it will be able to find out in a graphical representation how many patients, how many persons in the vicinity of 500 meters, 1 kilometer, 2 kilometer, etc. are infected. So this is your telco analytics. These are some graphical methods for advanced analytics of your coronavirus cases. Next comes the entire hand of AI which helps in fighting the coronavirus outbreak. The first among them is your deep mind. This deep mind uses your alpha fold system, which gives predictions of several proteins that can promote research in the COVID cases. Then you have your Alibaba AI, which gives 96% accuracy and has recently claimed that its new AI system can detect coronavirus in CT scans of patients' chest with 96% accuracy. Then you have your Baidu's AI. This team has released a tool which is called as a linear fold to reduce the COVID-19 prediction time from 55 minutes to 27 seconds. Then you have your blue dot surveillance. This blue dot surveillance play a very important role because in November 2019, this was able to give you a prediction based on the airline flight information that there will be an epidemic which is going to occur in days to come. So it takes the airline flight information to make predictions about the infectious diseases and could be air routes, and it can find out with a common disease vector based on it. Then you have your in silico medicine, a company that uses AI for drug discovery. It is using generative adversarial networks, GAN, to filter the molecule designs. It favors those that score highly for drug-like properties and for being chemically active, while tossing out molecules due to their properties are unlikely to ever work as drugs, such as metal components. So it helps in finding out the best drug composition, and for this, yeah, your GAN network is being used in that case. Next, you have your China's Infravision. So doctors in China have given you a new powerful tool to help them quickly diagnose the potential coronavirus sufferers. This is called as Infravision. It is an AI-based software which can quickly highlight the potential problem cases in record time. So the software relies heavily on NVIDIA Clara SDKs, which is used for giving a very quick output and processing vast amount of data in very less time. Infravision can identify typical signs or partial signs of COVID-19 in suspected patients, and the software looks out for signs of pneumonia that can be caused by the virus. Next, you may have your sense time facial recognition. The facial recognition is safer than fingerprinting as it removes the chances of disease being spread through human to surface contact. So sense time is applying AI to scan the faces of people with masks. They are promoting contactless identification of infected with a temperature detection software that has been deployed at underground stations, schools, and other community places in Beijing, Shanghai, and Shenzhen. Then drones are used for the rescue. So to reinforce the contactless monitoring of outbreak, drones were initially used in China for sanitizing the roads, the hospitals, and other places. Then UVD robots are also being used, which is based out on Denmark. They are using robots to disinfect patient rooms with zero human interference. Pandemics can make human assistance both critical and dangerous. So the medical personnel are at a higher risk. So UVD robots play a very important role for those medical personnel. So with the to start with, probably in the first week of April, when the data set was sufficiently good from covidindia.org, I was able to just collect the data, and just using three attributes of patient age, status of patient, whether diseased or recovered, Logistic regression was used to predict whether the new patient would get recovered or not. So this I was able to develop with an accuracy of 77%. Now, based on travel history, because initially it was a patient having travel history, that person is more prone to COVID. Now, slowly it has come to a community spread, but I'm talking about a month prior. So, using the travel history data, also logistic regression gave an accuracy of 91% with the available data. The available data at that time was hardly few 10,000 or something like that. It never creeped more than that. So the what can be done for aiding the present scenario is analysis of patients' criticality is very important according to age, because irrespective of whatever be the nationality, it is a common trend that patients above the age of 65 or those who are having critical ill components like BP or sugar or cancer, history of cancer cases, they are more prone to become critical when it is infected by this virus. So that analysis can be done, and analysis can be done on how it is affected in different regions, because there are different myths and different statistics or mathematical modeling which is coming into picture, which is telling climate plays a role, temperature plays a role. All these things can be tried out, researched upon. So till now, I have used only logistic regression, and it is only for finding out whether the patient will become critical using with COVID or not. But there is lots more to do. But the problem, especially with the data which is available in India, is the data staging area, because initially when the travel history was there, people were not willing to share it. People were not willing to it. Like most of the data is not entirely disclosed. So that issues plays a very important role when we mine the data, when we do a work on an algorithm. The accuracy definitely is not that great, and we require so many required parameters in order to have your holistic view on the prediction, which is still to be arrived at. We need to get so much data in order to have a holistic view of the predictions based on the COVID data. Now, for those of y'all who are interested into research using this COVID data sets, these are the different data sets which are available. The world data is available in data.world datasets COVID. We have lots of competitions which is coming out in Kaggle. You can take up the research challenge. Data sets are available. Work with your own ML algorithms and find out how best you can contribute to the existing problem. And the data pertaining only to Indian related data, you get it from covid19india.org. This is for the available data sets. Now, what is required? What is the need of the hour? Now, most of the work done so far is not peer reviewed. Most of the papers which I have got or which people had given me, it is not being published. It's not peer reviewed because it's latest. People are working in it. So we have to work more into it, research more into it, and check out for the authenticity of those new innovations which are coming out. And drug release is only in a very nasal state, and deep learning with the expertise of virologists is very mandatory in this particular area. So when I was just trying to pen down these points, I realized that yesterday there was a breaking news that COVID-19 vaccine has been found, and it's tested on human beings, and it is found that 8 out of 8 patients who this dose is being administered to, they have started showing neutralizing antibodies. So antibody levels which are similar to or higher than those recovered from COVID cases has been arrived by using these drugs. So yesterday that was a boom, and the Dow Jones market suddenly rised because of the new finding which happened in USA yesterday. Now, in India, ML should be used in different places, because I don't know whether it's a myth or it is the belief. We have attained the peak, or we have yet to attain the peak, because we haven't flattened it. So main thing is, can ML help in monitoring social distancing? So probably because we can use the concept of this thing, telco analytics, or somewhere some indications, so that people maintain appropriate social, some indicators to give them knowledge that social distancing has to be maintained, and predict the requirement of ICU beds with ventilators. Because if you see, most of the casualties which has happened in Italy, Spain, and USA is because they were not prepared to see, they were not prepared for the worst come worst situation, wherein we have lots of patients and availability of ventilators is not there. So somewhere, if this requirement can be predicted in advance, so many lives can be saved. Disinfecting, that will be a need of our, because now slowly when the lockdown is to be released in phases, before the persons can go out to either their workplace or schools or colleges, the entire area has to be disinfected. So if some minuscule robotics can be developed for disinfecting those places in every nook and corner of every rooms, or wide areas, that is going to be a big boon for most of us. And a mask with the capacity to monitor the body temperature and oxygen saturation levels to indicate the impact of COVID. Nowadays, we know that there are thermal temperature, body temperature measurement has come up. That is quite expensive, I think. So it costs around 7,000 to 8,000 per unit. But what if such a mask can be designed with some sensors and some embedded technologies inside it, so that when the person is wearing it, based on the indication, we will come to know whether the patient is safe or unsafe by some LED lights showing in different colors, say green or orange or red, indicating whether the patient is likely to be affected or not affected. So it is going to be a boon not only for that patient, but also to the person surrounding him. So ML can be used to predict the economic scenario for the next couple of months after lockdown is revoked. This is exactly a different webinar topic, which can't be touched right now, because there is lots and lots and lots of work which is to be done and which is going on all over the world in this particular area. So these are my references. So I have referred to a couple of web references from towards data science and in about COVID and analytics India. And these are some of couple of papers, and some of the colleagues have also shared some papers with me. And this is for my references. So this is for my webinar for today. So any queries? Any queries? Any queries?
Yes, ma'am. We'll give you the questions that the people have asked.
Yeah.
Okay. So I have Mr. Yunus Khan. Just a second, ma'am. He has asked whether we can apply the machine learning and IoT for data analysis purposes, and whether digital forensic science can be used for these medical examination records and further. Yeah, that is what he's asked.
Can you repeat for detection?
Yeah, whether you can use digital forensic science for the acquisition of X-ray and CT scan images and medical examinations.
I'm not a person in digital forensics, so I won't be in a position to comment it. But one of your this thing college person, I think so. It's Mr. Upendra. Yeah, Upendra Singh. He has just given me a couple of shared a couple of papers. In that couple of papers, one paper was using AI based. So using AI based, without the intervention of the doctor or the medical assistants, the patient themselves will be able to position themselves in the CT scan. Directly the CT scan report is being extracted. Then you had a dense CNN network wherein the positioning the affected lungs is being segmented, and the extent to which it is affected is found out with least intervention of medical professionals. So that is present. In the link I have shared that paper. But regarding the role of digital forensic, I can't comment because I'm not a person in digital forensic. So you have questions pertaining to what are the predictors in logistic regression model. So as I've told, this work was done a month back, wherein I had just taken a very minimal parameter like age of the person, gender of the person, and whether the person has traveled, has a foreign travel or not. And based on it, using logistic regression, the prediction was whether the person, what is the severity extent of the person, whether the person is prone to be very severe COVID positive person or not. So in other words, what was the this thing, a recovery rate of a person was being computed using your logistic regression. So
Okay.
anything else other than that?
Ma'am, I have a question of my own. Can I please ask?
Yes.
Ma'am, since Google and services like any mapping service, they normally, when you install their app on your phone or if you have their services activated, they keep a location history.
Yeah.
So, ma'am, can we not use this location history in knowing what people have come into those areas that were hotspots previously, or determining whether these people were more?
As such it is being done, as such it is being done based on the mobile data, based on the positioning when the person is moving out. If you are in quarantine and you're being asked to be in quarantine for a minimum of 14 days, and with the handheld device, it can be a smartphone, it can be your Fitbit. If you are moving out, those patients are being traced, and it is being indicated to the nearest police station or BMC official that this and this person is being tracked outside his jurisdiction. That work has already been done. That is in a very minuscule level, because you know that in India not all, if you see the spread, especially in the slum areas, people don't are not accessible to smart devices. So it is in when they are in sufficient, people have all this smartphones or accessible to all this Fitbit. In such places it's actually being done, it's being done for tracing.
Okay, ma'am.
Yeah.
Uh, people, I mean, everyone is free to ask questions in the Zoom chat or by raising their hand so that I can see it. Uh, Please forward your questions to the WhatsApp link that I've provided or on the Zoom chat.
Reference.
I've got this question. You talked about the Arogya Setu app, right?
Yeah.
Uh, some of them are asking whether how is ML being implemented through this Arogya Setu app?
ML is not exactly being implemented through your Arogya Setu app. The Arogya Setu app, it gives you an indication of the graphical analysis. Like, I don't know how many of y'all are using it, but in Bombay, it is mandatory to use it because the number of cases are more in Bombay. So once you install the app and you register through that app,
what happens is every time there is an update, it will like once in a week, it will ask you to update. It will ask you some basic preliminary questions, whether you had cold, fever, have you been in contact with any other person with COVID. So based on the data which you provide, it will mark you as safe or unsafe. If you are unsafe, if you're telling that you had fever, and if you have contacted a doctor, you can share the data. And once that data is being shared, then it will try to find out the location around it. That is, if I stay in a particular society, the jurisdiction of 500 meters, 1 kilometer, 2 kilometer, what are your data will be available to the persons. That is, it will mask your entire data, but the society name will be visible. There is no ML which is being used in this case. It just gives a graphical format of representation of the red zones in your particular area. That's it. So NLP, if you can give more info about the use of NLP in this case, see, I think so NLP I have told pertaining to um, the doctor diagnosis of the X-ray and the CT images which are being automatically scanned. So for that, deep neural layer or along with CNN is being used. So I can just share the references which I have given to you all. It's freely downloadable, and most of the work which I have spoken, I have just tried to cover up in the references.
Okay, ma'am. I'm going to wait a few more seconds for any other questions, and then we're going to move on. Ma'am, there's a question. Since you've mentioned about NLP already, Miss Shraddha wants to know what is the use of NLP here.
First of all, I need to find out in which slide I have mentioned the use of NLP. So I can refer to the So is it in the area of diagnosing medical image, or is it in that area? Can you just find out, can clustering be used for deciding the red, orange or green zone? Yeah, clustering can be used because you can find out the distances between the affected person, the society, and the circumference of the other persons. We can just use the clustering in that case.
Okay, ma'am. I think that's all the questions for now. I would like to invite Muskan Bagre for the vote of thanks, and so that we can complete this webinar session.
Yeah.
Am I audible?
Yeah.
Yeah.
Okay. I think we have reached the end of our session, right? I would like to thank our speaker, Ms. Anuradha ma'am. We know how busy she is. Thank you so much, ma'am, for taking out your time and enlightening us. The information that you provided was very important and it was very good to know. And I would also like to thank Mr. Jitendra, head of Village. Thank you for making this workshop possible. We look forward to more ventures like this. Also, I would like to thank our HOD, Dr. Sunita Verma, and our director, Professor Rakesh Saxena, for their constant guidance and for providing us this opportunity to conduct this webinar. Lastly, I would like to thank all the candidates for their active participations. Hope you had good learning. Thank you so much.
Thank you, Muskan. Thank you everyone for this session. I hope you learned a lot from this, and please look forward to more sessions from us like this.
Thank you so much.
So
Listen,
thanks a lot, everyone. Thanks for giving
Okay,
me-
I think HOD ma'am would like to say something.
Yeah.
I thank from my side to Anuradha madam, and I want to thank the organizing team of our department, including faculty and the student who put lot of hard work to organize such kind of the webinar. So I also want to thank the organizing committee also.
Thank you, ma'am.
Thank you so much.
Thanks a lot.
Okay. Thank you, everyone. Please be sure to fill the feedback form once we send them out to you. The rest will be contacted to you on WhatsApp. Goodbye.